Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about PRP, which is Platelet Rich Plasma, specifically for the use on the face. So PRP is used in other applications too. You may have commonly heard about it for use in hair restoration, where we can inject it into the scalp, or we can use it with microneedling on the scalp to help hair regrow. We can also commonly use this in the genital area for both men and women to help with sexual function. But on the face, PRP is an extremely useful rejuvenation tool. And we can use it in two ways. We can either inject the PRP to get what we call basically a PRP facelift, or we can use it in conjunction with microneedling or other laser procedures that partially remove some layers of the skin so that the PRP can penetrate into the skin, and then we call that a PRP facial. But the most traditional way of doing a PRP facial is usually with microneedling, though we can use it with a lot of other lasers as well. So the PRP procedure is pretty simple. It involves using your own blood. So we want you to come in pretty well hydrated, make sure that you are nutritionally fit, and then we take some blood from usually your arm or any vein that we can easily get access to. We put it into a little vacutainer that has a special solution that is going to help separate the red blood cells from the rest of the plasma. The plasma just looks kind of a golden color, so that's our liquid gold that we're trying to harvest. And this PRP is really rich in growth factors and other substances like calcium, serotonin, and so on, which help to reduce inflammation in the skin and help to stimulate your skin to make new collagen fibers. So those are the two main functions of the PRP in the skin in terms of healing. So it helps with wound healing, it helps with regeneration of tissue. And there are two ways to get it into the skin. Like I said before, we either inject it or we apply it topically in conjunction with a treatment that has created little channels throughout the skin so that the PRP can absorb into the relevant areas of the skin. So when we inject it, we can use it by itself or in conjunction with any of our other fillers to enhance the fillers. Usually the PRP filler, when used in that way, will last for about 18 months or so. And I really love using PRP right under the eyes and the hollows, but we can use it anywhere on the face to give you a more natural lift, especially for patients who prefer to use their own substance and would prefer not to use one of the other available fillers that are on the market. And then of course Kim Kardashian, she made famous the PRP facial, which involves using microneedling, and in that case the skin is numbed first with a topical numbing medicine. We wipe that off really good, and then we can use your PRP as the substrate to glide the microneedling tool over the skin, and that creates little tiny wounds throughout the skin with tiny little needles. And then we continue adding more PRP to the skin, and that gets absorbed and helps you heal from the microneedling procedure faster, but it also helps to stimulate more collagen and you get a better result. I also love using PRP after any of our other fractional lasers, such as fractional or fractional, and also with the fractional radiofrequency technology, because all of these are going to create little tiny channels through which the PRP can penetrate into the skin. The PRP is also really beneficial in acne patients. So again, it helps to reduce inflammation and it helps to calm down the acne. Other areas we can use this is of course on stretch marks too, but I specifically wanted to mention the facial rejuvenation aspects of PRP today. So I hope you found that helpful, and thank you for listening.